During the course of this instruction, you're going to be seeing some videos. These videos have been added as best practices. As you are well aware, situations change from person to person and site to site. If you have any questions at all, please contact site leadership for your answers. Thank you. So let's use the THD to scan a backpack that came in potentially on maybe an EMS arrival, or even through your ED through the magnetometer. So what I like to do as I'm doing the searches, I'll scan the back of the backpack. Now remember, keeping the THD an inch to 2 inches off the backpack will allow you to penetrate the backpack by 2 inches. So about to the zipper compartment. What this is telling me is that I have no concerns about metal being anywhere in this backpack from the zipper backwards. So now I can concentrate any search efforts that I have, any screening efforts, to the front of the backpack. I can do the same thing on the sides. Now I'm going to go to the front, and you see that we have a pocket here. I immediately identify to this side of the pocket, and I have a long signature in the front of the pocket. So I'm going to identify the objects in there first. THD is equipped with a flashlight to help you search. So I can identify that I have a keychain and a wallet in there, but everything in this compartment is identifying as a target. So let's go ahead and remove those carefully, always gloved. We're going to search that area again. Now I can see that that pocket is empty, but the THD is still alerting the metal. It's alerting to the metal at the bottom of the center compartment in the front. So I know that that's going to be a target area when I search the center compartment. Looking at the center compartment, we have 2 separate bags inside. I asked the patient for permission to remove these so I can get to the items underneath. I take the bags out separately because they're self-contained, and I'll search them in a later time. I'm going to take the THD again, using the barrel of the THD in conjunction with the flashlight, and moving items around with the device. I have a hairbrush in here that's alerting for metal. I'm going to remove that hairbrush. Remember, we said that we had an alert in the front of the bag. Again, deploy the light. Nothing here. I'm alerting to metal on a rolled pair of socks. I'm going to remove that pair of socks from the bag. I'm going to move the THD again around through the bottom with the light deployed through all the rest of the clothes. You'll notice that the light goes off every once in a while because I'm coming close to the zipper here. But inside the bag, no detection whatsoever. So the clothes here are free of any objects that we would be concerned with. Take a look here now at the bag. Just a simple looking bag. It's clear, see-through. You would think it makes my job easier. We're going to go through this bag. Since we're out in the light, we don't need to deploy the flashlight at this time. So I'm hitting on that lipstick. I'm going to remove that lipstick momentarily. I'm hitting in this area. Could be hitting on another lipstick. I'm hitting on what appears to be a plastic brush. That's going to cause me some concern, so I'm going to remove that. Going through the rest of the bag. No more metal signatures discovered. Lastly, this closed shower bag. Again, it's a little dark in there, so I'm going to deploy the flashlight by holding the button down, keeping it held down. I immediately hit on this small plastic object. I'm going to remove that object. Going through the bag again, I'm hitting on another plastic container. And at the bottom of the bag, underneath a series of pencils, pens, eyeliners, just a simple nail clipper. But again, found in the bag, no other items of concern. Let's take a look at some of the things we found during our search. Remember the comb, the plastic comb? So that's quite a hit. And inside the comb, blade. Now the magnetometer assisted us in finding this, the handheld magnetometer, the THD. Also a visual inspection. If you look here, you can see the separation. To me, that would cause me to be suspect, especially after a positive hit on the magnetometer, and things like this need to be checked. These are just simply nail clippers. We're going to check the compact. So it's a mirror, and the foil on the back of the mirror is likely what was going off, or perhaps the hinge. The lipstick goes off, but as you can see, it's lipstick. This lipstick container goes off, but quite a bit more, a lot more dramatically than this one. Let's look at it again. Now watch the difference. You can see the signature area. It's almost a near constant. So that causes me concern. So we're going to take a look and see why we should be concerned, and that's exactly why we should be concerned. The last thing that we retrieved from the clear makeup bag was some sort of plastic card. Let's take a look at that plastic card. Again, look at the signature. For training purposes, we're going to leave that in there, but I'm going to show you that plastic card in real time. None of us want to face that in an ED setting. Moving along from inside the book bag, we'll do the easy ones first. A keychain, normal keys on it. These are new. They're marketed as a self-defense weapon. They're basically a version of brass knuckles. You put your fingers through here and use the spikes to cause some serious damage. Most people will look at that and say, all right, I'm going to have to take that for now, ma'am. Thank you very much. Inspect the whole keychain, because on the other side of that keychain, we have this. Should be easy to tell, but if you're focusing on one thing, it's very easy to miss the second. A very sharp and serrated push dagger. And even though it's small size, placed in your hand and used when punching, you can imagine this could be used to a very devastating effect. Again, something we don't want to face in the ED. Next, we have, from that front pocket, the wallet. We'll go through the wallet. You're picking up a small signal at this point. We're picking up that signal because I'll give it away. We are close to the zone for the other side. As we get within the 1 to 2 inch range, watch the change. So our object that we're looking for is right here. And again, it's another one of these inside that wallet. Hard to see, and if this wallet was filled with credit cards and gift cards and so on and so forth, it would be almost impossible to detect. If you can't see it, right there is the strip. That's that same card folded up in the wallet. It's going to be up to your location how we handle these things. It can be sequestered in the security office. A patient property envelope can be given to the patient, and these can be locked up in a safe. They can be sequestered in another room in your ED or on your medical units, your nursing units, and it can be handled that way. It's going to depend on your particular situation, but in my experience, it's better to just tell the patient we can't clear it, ask if we can sequester it, explain to them why, be polite, be patient, and let's take away any potential threats there are. We have 2 other items to check. My first question is, why are these socks alerting to metal? So let's take a look. I'm going to do the squeeze test here. I have a solid object on this side of the sock. Since we don't know what we're dealing with when patients are coming from out in the civilian world, I now have identified this sock has a foreign object in it, and that foreign object is a fairly nasty little folding knife. Which brings us to our last item. This is a hairbrush that alerted. You see it's showing me that there's a metallic signature. I'm getting a metallic signature in the front, small, right at the band, and from the back of the handle. So it's worth a look. So we're going to search it visually. You can observe that there's a USB port here. Further visual inspection shows what appears to be an on-off switch, some sort of button to activate, and these marks here look to me to be a battery life indicator. If we remove this, the barrel comes off. When we turn it on, we can see we have a battery life in there. Now the only thing we don't know is what happens when we press the button. So let's press the button. There's not a lot of charge in it. I would not want to be hit with that in the ED. When using a handheld magnetometer or even the Garrett 6500i walkthrough, just remember, it is a device. It is not a human being. It deals in facts and data. It's up to you to do your due diligence. Look at things, question things, use your common sense. One of the items that we have here is this. If I'm coming through your magnetometer, ask yourself the question, why does this person need a brush? There is nothing up here that this brush is going to make any difference with. However, This brush did not alert for the handheld magnetometer. I appear not to have a need of it. There does appear to be a crease here. This is not all one piece. And so if I apply a little pressure to the bristles and pull it out, I have this. I know that on a video you cannot tell, but I assure you the point on this is extremely sharp and would do a lot of damage. As you're going through these things, when you're stationed at the magnetometer, or you've been called to wand a patient, or you're in the ED entrance and you're doing EMS arrivals, please use the magnetometer, put faith in this THD, but always remember it's there to help you. You have to do the job. 75% of this is you, 25% are the tools that we use. Have a safe day.